Hey guys, good morning. I wanted to talk to everybody about a conversation that I had with a young gentleman the other night. He just opened up to me. He was kind enough to share with me about his past history, about the struggles that he had with mental health. And I'm not talking about anything bizarre. We're talking about anxiety. And they told me I was on medication and I got frustrated with the process, which is totally understandable. It's a difficult process to get your medications dialed in. But then I was like, well, how are you doing now? And they told me that they've been having issues with their anxiety and it's just out of control a lot of times. And the reason why I wanted to share it with everybody is there is a stigma associated with anything related to mental health, whether it to be depression or anxiety. There's a stigma out there. I pulled up some statistics just to reinforce what I'm saying. What they have found is in the American Psychological Association showed that 35% of adults admit that they would view someone differently if they had a mental health condition, which is just absurd. But that's exactly why people hide in sharing this kind of information, because they're worried that they'll be seen different. But here's some other information. The Zebra's recent data showed almost 6 in 10 people, so 60% of people with mental illnesses receive no treatment or medication at all. People are literally just white-knuckling it through life. And it's just so bizarre, because the analogy that I tried to make with this gentleman was like, if a patient came in and their blood sugar was 400, we wouldn't just tell them, maybe you should just have a better attitude about your pancreas. Or, hey, you came in with high blood pressure. Maybe you should just try working through it. It doesn't work like that. So if we can have, and I hope that everybody shares this, because this needs to go out to everybody, not just the people who are struggling, but there needs to be a massive mindset shift in America and throughout the world. And always, I got to back this up with scripture. So if we look at Matthew 9:12 says, "It is not the healthy who need a doctor, but the sick." Jesus himself validated the role of medical intervention. Taking medicine for your brain chemistry is no less biblical than taking insulin for your pancreas. 1 Kings chapter 19, 4-8. So Elijah was deeply depressed, suicidal, begging God to take his life. God didn't shame him or tell him to pray harder. God sent an angel. He gave him a nap and a hot meal. These were practical, physical things that he did for him during this mental and spiritual crisis. And then the last scripture that I want to give you guys is Galatians chapter 6, verse 2. Carry each other's burdens, and in this way you will fulfill the law of Christ. We can't carry someone's burden if we make them too ashamed to tell us about the burden that is heavy. We have to be more accepting. I want to hit you guys with some more statistics, and this is the kind of stuff that I see working in the emergency room. 1 in every 8 emergency visits in the U.S. is related to mental health. 1 in 8. Let's see. Adult behavioral health patients have a 25% 30-day readmission rate compared to just 15% for physical health patients. So if I go in with for high blood pressure or a wound that won't heal, there's a 15% chance that I'll be back. But mental health patients have a 25% chance. And maybe you're thinking, hey, that's not so bad. But what they have noticed, the National Institute of Health has tracked the national trends and found that the percentage of ED visits where patients had 2 or more mental health diagnoses is documented has more than doubled in just the past decade. Because when illnesses go untreated, they don't just go away, they compound. So what I want you guys to think about, and this is everybody out there, how are you doing? Is today a good day to talk to a friend and be honest with them? And if your friend comes to you today, are you going to be accepting? I want you to view mental illness through the same lens that you do a physical ailment. You're not going to shame your grandma for having cancer, but will shame her for having anxiety? Doesn't really make sense. It's brain chemistry, or it's an adaptation to something traumatic that has happened in their life. We got to do better, especially as Christians. This is a call to everybody out there. Reach out to each other. Check on your loved ones. Check on your friends. And if you see someone out on the street and you can tell they're struggling, ask them how they're doing. Be that olive branch and just check in. Now, it is Mental Health Month, so you should probably say check on the men in your life. But I'm going to say check on everyone. Check on yourself first, because you can't, just like in Galatians chapter 6, verse 2, we can't carry each other's burdens and fulfill the law of Christ if we're not checking on ourselves. A classic analogy that they give is like a airplane that's going down. The oxygen masks drop down, right? And what they tell you to do is put your oxygen mask on first so that you don't pass out, and then you assist the people next to you or anybody around you that may need help. You can't help anyone unless you help yourself. So if today's the day and you've been struggling, what I'd like you to do is either reach out to a friend, reach out to a loved one. If you have a primary care provider you're established with, see them and be honest about how you're feeling. You don't have to suffer through these things anymore. You just don't. There are so many medications available, and it can make a significant difference in your life. If you're not struggling with these things, if you're thinking, oh, Anthony, I've got my meds dialed in, like take meds every single day, and I love it because I'm dialed in, I'm great, I'm focused, right? Check on your loved ones and make sure they're okay. I hope you all have a wonderful and beautiful day. Also, I've added a lot of churches in the local area of where I live. If you're noticing my videos and you want to be a part of this ministry, or for me to, if you feel like my ministry of incorporating mental health with Christ can help anyone in your congregation, would love to come and talk to your congregation. I feel like my message can resonate with everyone sitting in your pews. Be happy to start a conversation. Send me a message. I'd love to see what we can do to help the people that are important to you. Have a blessed day.